director of the Frankfurt facility. And we also have, who is it?
Dr.
Hamden, who is Doctor of Hematology and Oncology. And they want to talk to us a little bit today about some of their programs that they're currently actually running at their facility. So, Beth, do you want to give us a little bit of...
Thank you very much for having us.
You're welcome.
Dr. Hamden is our oncologist, as you mentioned, at our Frankfurt campus. We also, at Frankfurt campus, offer primary care. Other specialty cares are in there. We have neurology, pulmonology, rheumatology, neurosurgery, pulmonology, the whole gamut almost. Soon to come is ENT. We also have diagnostic testing. We can do your CAT scans, X-ray, labs, ultrasounds, echoes, and more services to come along those lines also. And we can take any doctor's order or referrals for services at our clinics. Doesn't have to be a Riverside provider. So if you live in the area and you want to stop in, have your lab drawn, you can just bring your lab order in. We can get you taken care of right there on the spot. And we're just here to introduce Dr. Ham today and talk more about the services that he does at Riverside. We do have oncology services at 3 locations. Our Betty Birch Cancer Center is in Bourbonnais. We also have oncology services at our Watsika campus. And Frankfurt campus just celebrated their 2-year anniversary last weekend.
Ah, congratulations.
Thank you. Yep. So we are growing, very excited to be in the community and providing more services. And we just wanted to talk about, the importance of what you can do to stay healthy so you don't get cancer. Prevention is better than cure.
Definitely.
And, the services that we can provide, the hematology. We also do infusion services, so if you need infusion medication treatments, we also do that on site, blood transfusions. We do offer free screenings for lung cancer screening. If you have qualifications, we can talk more about that. But I'd like Dr. Hamden to talk more about what he does and his passion for oncology.
Welcome to the show.
Thank you. So I'm Dr. Hamden. I've been practicing in oncology for about 5-6 years now. I'm actually from Orland Park, Illinois. Grew up there, went to Sandburg.
Ah, so did I.
Really?
I graduated from Sandburg. We won't talk about how many years ago.
No, we won't.
Yeah.
Just a few.
Then I went to Benedictine University as an undergrad. Then from there, Midwestern University, and I did my training at Christ Hospital, as well as St. James Hospital in Olympia Fields. So there's a lot of exciting things going on with oncology these days. I am very pleased to see all these new changes that we have, new medications available. It's not just the run-of-the-mill chemotherapy that makes you very, debilitated. Sometimes stage 4 cancers, where we used to only have a few months survival, now could go on years with just a pill. So I feel like the general population should be aware of that. Because sometimes, unfortunately, people are timid, scared, they don't want to go through this, and they think it's going to really impact their quality of life.
Sure.
When in actuality, it's actually adding more time to spend with their family, loved ones, and enjoy life.
Sure.
But like Beth mentioned, we have several different things we could offer at our Frankfurt location. Riverside likes to be, provide health or wellness within reach, basically.
Okay. All under one roof.
All under one roof. You have all the specialties, like Beth mentioned, basically all the ologies.
Sure, all the ologies, right?
Yes. We do offer, CAT scans for lung cancer screening for free.
Okay.
If patients have had a history of smoking for more than 30 years.
Okay.
Oh, that's wonderful.
Yeah,
that is.
So that's something we take advantage of.
Absolutely.
If you're age 55 or over.
Okay.
Because now we are able to find lung cancer earlier, and the chances of cure are much more possible now.
Sure.
If you find it
early on.
And it's actually, data has shown that it's better than mammograms is for breast cancer and colonoscopies for colon cancer.
Wow.
So you can't go wrong with just stopping by and seeing if you're a candidate just to get it out of the way and not have to worry about it.
Right.
Absolutely.
It's always great to be proactive with
Definitely.
screenings, no matter what area, aside from lung cancer. When we look at what's recommended on the regular schedule with colonoscopies and mammography and, exams for men, prostate exams, all those things, because we don't realize, sometimes we say what we don't know won't hurt us, right? But I think it's important for us to be more proactive, especially with today's advanced medical procedures and different advantages. And I think we need to be educated. We've talked about this all throughout the show today.
Yes, education.
This growing theme about education in various aspects of our life, and
Definitely.
how technology has allowed us to have this opportunity to get online and just find anything. And as medical professionals, we've all Googled a symptom, right?
Yes.
And we know that doing something like that can open up this huge can of worms.
Correct.
And many times that information might not be from a reputable source.
Correct.
So instead of sitting at home in front of the computer and trying to think about, well, gee, what does it mean when I feel like this?
Or being your own doctor.
Correct. Reach out, to a reputable medical facility such as Riverside and figure out, stop in and get an appointment and figure out what it really is at the early end of things.
Correct.
Rather than waiting until something, is much
Absolutely.
more
That's so
much
important.
more serious.
Absolutely.
Exactly.
Absolutely.
And I think we have to train ourselves to think that way.
Definitely.
As a woman, I think we are a little bit more prone to the annual screenings because of just the nature of, our own health, right? And we're expected to do that, but sometimes, there may be, and for men it may not be the same way.
Correct.
And I find that, in my experience, they don't typically do that, and you encourage folks to be smart about it.
I mean, I'll never forget a man who I took care of 10 years ago. He was a Vietnam War vet.
Okay.
So he actually survived. How much atrocities happened there, how many American lives were lost. But he didn't go for a colonoscopy. So it's sad because it would have been prevented.
Correct.
And would have had so much more life to live.
And isn't the survivor rate of colonoscopy, isn't that one of the or colon cancer? That's one of the more, I guess I don't want to say it's simpler, or it can be the recovery, the risk.
Remission.
Yes.
The remission is it's a more curable, if that's the right word to use.
Yes, you are correct.
With early detection.
Correct.
So I mean that's something that we should really be looking at. Family history, genetics play, and I don't know, Doc. I mean, sure.
Yes,
I
definitely.
talked to a friend of mine who, very good friend of mine who has been dealing with a very rare cancer and has gone through various different procedures and things, and her cancer is a genetically predisposed paraganglioma.
Okay.
So it's very unique. Not every physician knows about this. It's a very complicated disease. But more and more, as she does more of her research and is doing extremely well, she finds that genetics are playing a really important part in the oncology world.
It is definitely. So we look at mutation status, and that's what allows us to use a lot of the pills that we talk about.
Okay.
So cancers that people would have died just months after diagnosis, like I said earlier,
surviving years.
And
With a better quality of life.
with a much better quality of
yeah.
life.
True.
And not even usually for females, the major concern is like losing their hair.
Right.
And that's not all the time. Guys lose their hair without the chemo.
Right.
Yeah.
I was just pointing at my head.
I was gonna lose it.
Well, immediately what we think of with cancer treatment, we think of radiation. Back in
That's
the
what I
old
was
days,
gonna say.
right?
Yes.
X marks the spot.
Yes.
And, and maybe that is a form of treatment for some cases, but it's not.
It's not the only treatment anymore. And I think, I had no idea. When I think cancer, I think, okay, got to start chemotherapy. That's the next thought. But it seems like there are so much more advances in technology with medication and treatments and stuff. So there are other options.
I mean, if your iPhone is now where you get your email, where you send money to people, where
my life.
You take videos. It's like, just imagine what medicine does,
Yes.
So,
Right.
and the thing is, everybody's still encapsulated in the time of those movies where people were just like thrown up into buckets.
Right.
Exactly.
And just a hospital ward of cancer patients.
Correct.
And that's really not the case. Most of cancer treatment now is outpatient.
Okay.
True.
No staying in the hospital.
Right.
You know, we're as focused as trying to cure your disease as we are on your quality of life.
Yeah, there was a commercial. I don't know which healthcare system or which organization does a commercial about your chemotherapy at home.
Okay.
And it's a commercial of a husband and wife, and she says, you know, you've seen it probably, and I don't even recall who's.
It's the drug company.
Oh, is that what it is? Okay. And I see that, and I think, you know, how convenient and how comforting that is, where you are with your family during this time. You're not in, you know, a clinical environment.
Exactly.
So I think we have to challenge everyone that's listening to think out of the box a little bit and try to get more information and be better educated in this regard.
Exactly. And screening is most important because early detection is more likely to be cured than, you know, waiting for symptoms.
Absolutely.
So if your doctor's telling you for a colonoscopy, I tell them, you know, one day of having bad diarrhea from that, you know, from that drink,
from that delicious drink.
Know?
Not a bad thing.
Not
a bad thing.
Much better than having to have surgery and 6 months of chemo.
Absolutely. We're going to thank you, Doctor. We're going to take a quick break here. We're at 1340 WJOL, Friends Over 50, Will County's Talk Radio. We'll be back soon.
Allow me to ask a couple of questions. If you answer yes to any of these questions, please listen to this message closely. Do you have arthritis, neuropathy, carpal